many EDSers typically have heavier periods than normal. I'm Susan Chalela, and I'm a physical therapist specializing in Ehlers Danlos Syndrome and upper cervical instability. Again, you're dealing with fragility of connective tissue. You're talking about the lining of the uterus that's shedding every month.
Yeah.
I mean, when you got more fragility there, you're shedding more. I know personally that my periods were much more heavier than any of my friends, and we didn't talk about this stuff. But I mean, seriously, today we talk about it, and I hear that from my patients.
Yeah.
So they do have heavier periods, and that is very disabling, very fatiguing.
And so you were saying that Sherpax Cloth Pads can be used for several of your patients, and why is that?
They're a great thing. Because they're reusable. A lot of my EDS patients a lot of them are on disability, or don't have jobs. So there's just saving money, and disposables, they're expensive. And so this way, when you do your normal laundry, you put them in. And then you have them every month. It's money saving. They're much more comfortable. Disposables are so uncomfortable.
Yeah.
And these are much more comfortable. The Sherpax are, the fabric in general, and they're absorbable, and you don't have to worry. They're kind of worry-free.
Okay.
So
I know that you were saying, is it tethered cord or something that can cause an issue?
There's another issue that typically we see in neurological implications with these patients is tethered cord syndrome, and that's where with the cord we can have urinary issues, so we can have frequency, urgency, incontinence, things like that. And so again, these soft pads, if you're having to wear them from day to day, they're just much more functional, much more comfortable. You feel like you're wearing your underwear, but you don't have to worry about having to bring extra pairs of underwear and pants with you and things like that. These pads do what they need to do for that. And so, and it's very typical for a patient to re-tether later on. So some of the urinary stuff can happen again. And then you've got aging. So physiology of aging in general, then we've got, it's like, is this tethered cord, or is it, just the effects of childbirth in our body, pregnancy, childbirth, and then aging after that. Our muscles just down there, pelvic floor muscles, are not as effective.
Buy your cloth pads now at Sherpax Women and Sherpax.co.